mainly women.
The Council of Governors is now faulting the national government for its push to send trained nurses out of the country. The COG Health Committee Chair and Tharaka-Nithi Governor Muthomi Njuki says this move should be rescinded, adding that the government should invest heavily on healthcare system instead of sending them away.
Council of Governors the wrong way as they now demand a rethink of the whole policy. The governors have questioned why health workers are being sent outside the country to seek greener pastures, yet the situation in the country is dire.
We spend as African countries a lot of money in training our health workers, and we are giving them out for free to Western world. At the ignorance of assuming that they need jobs because they're jobless, yet our health facilities have a shortage.
Speaking at an international workshop organized jointly with the University of Nairobi's Institute for Development Studies and the King's College of London, which brought together African health institutions working on the curriculum for modern healthcare, Council of Governors Health Committee Chairperson Muthomi Njuki said county hospitals were greatly suffering out of budgetary constraints, yet there is room for both levels of government to sit and agree on a framework to improve healthcare system. Currently, the country has about 14 healthcare workers for every 10,000 Kenyans.
Why is it that we have very many nurses who have been trained coming out of the nursing and medical colleges, yet we have shortage in our facilities? It is a question of affordability, it is a question of funding to health.
But in a quick rejoinder, the Minister of Health says there is enough workforce in the country to work for the national government, counties, and send the extra practitioners outside the country.
Sometimes in our space of regulation, we find that, like I'll give an example just from medical school, CF is here. They are producing 1,000 doctors now. 5 years ago, they were producing 300.
Currently, the Kenyan public sector has a health worker crisis with only 14 health workers per 10,000 Kenyans. So even when we talk about exporting health workers, it is a paradox.
A report by the Council of Governors for 20 counties shows that 362 doctors are away on study leave, while 135 have completed their scholarships and are expected back to the country. Shadrack Miti, KTN News.
In a bid to